amazing conversation. Now, in this session right now, we are going to have a chat with Derrick Bishop. Derrick, are you on?
I should be there now.
Yes, we can see you though. We can hear you.
Yeah,
okay.
Oh, there I am.
There you are. Hi, Derrick. How are you?
I am fine. Thank you very much.
Right. So, folks, this is a session where Derrick will talk about his story with cancer. I would like to remind that the session is going to be recorded. Derrick is under no pressure to answer any question he's not comfortable of, and we ask everyone to be mindful of the privacy while engaging with Derrick or putting questions or comments in the chat box. So, Derrick, so let's start. Please unmute yourself. Are you unmuted?
Pardon?
Oh, okay, you are unmuted. No, good, great. Derrick, so tell us a little bit about yourself. Let's introduce you to our folks. Do you want to tell a little bit about yourself?
Yeah,
Catherine?
sure. I live in eastern Newfoundland. I'm living about 20 minutes drive from St. John's, actually, in a microclimate. So we always have better weather than St. John's. That's one of my claim to fame. So a lot of my friends in St. John's resent me because I'm always boasting about it's warmer, it's sunny, no fog, and no rain, and less snow. So my journey, I guess, introducing myself, began probably in 1961. Now, you can look at that. You can obviously see I'm probably over than 39, but in 1961, I was 7 years old, or just turned 7. And at that time, my father was diagnosed with cancer for the 3rd time. He had his first cancer in 1949 when he was around 29, 30 years old, and that was a colon cancer. In about 1960, he had a squamous cell carcinoma, and in 1961, he was diagnosed with a primary cancer in his pancreas, primary cancer in his stomach, with metastasis to the liver. And he, at that time, was sent home. That would be in October of 1961, and he died at home in March of 1962. So that period of time from October to March, there was really no treatment. Occasionally, he had a medical visit for medication for pain. But other than that, there was no treatment available. My father died on late Thursday evening. He knew he was dying. He spoke to myself and my sister. Excuse me, I find it a bit emotional at times. He was buried on Saturday after his death, and I returned to school on Monday. And I would say at that time, I suffered from post-traumatic stress because of my father's illness and death. And as you can see, I'm still emotionally affected by it. I know for a number of years, I would promise myself to sleep each night. And that went on for probably at least 5 years. And I was always terrified that other immediate family members would get cancer and would die. Of course, at that time, we didn't know that this was an inherited issue, although there were, numerous cancers in my father's family. So I'm currently retired. I was a nursing instructor for a number of years. I was first diagnosed with cancer in 2021. I sit on a national committee for inherited cancers, and I also sit in the public interest group on cancer research here in Newfoundland. I'm on 3 support groups for prostate cancer. One is local here in Newfoundland, and one, 2 others. The other 2 are international, really. They the scope that they cover with it's across the world. So that's me. That's the introduction.
That's you, Derrick. Thank you. And yeah, so it's always very touching to hear patient and family stories. And I know that it's not always easy. So thank you for sharing your story, despite it can be challenging time to time. So you made a couple of great points. One, how the treatment, etc., has progressed since your father was diagnosed with cancer. I think we all need to be a little bit, aware of the good progress happening in the cancer front as well, in terms of, screening, in terms of treatment, and so on over the years. It may look like it's not enough. Maybe it's not enough because we are still losing people, but it's progressing fast. So this is really great news. The other thing you, again, and in the morning as well, Kara made a good point, and later Trace as well, the impact of cancer on the children, other family members. Right, so and PTSD, post-traumatic stress syndrome, certainly may happen. Again, cancer is personal. Everybody has a different experience, may have a different experience. But thanks again for sharing. These are really important points. And the other thing I want to say is the fear associated with cancer. But I think we are also sharing a lot of great news today. So Derrick, I know you are very much involved in cancer and actually helped a lot of people around the globe. So do you want to tell a little bit about your involvement with the cancer research?
Yes, well, actually, I first became involved with cancer research when I was approached by Dr. Jane Green, medical genetics at Memorial University. Dr. Green had learned that I had considerable information about my family tree, and there was a patient of Dr. William Pollitt, who was a surgeon here in St. John's, who said to Dr. Pollitt, "Why is it that so many people in my family are coming down with all these different cancers, particularly cancer of the bowel?" And so Dr. Pollitt put this person in contact with Dr. Green. And so the investigation started, trying to determine, is this a genetic cause? And Dr. Green was aware that there were 2 families in Newfoundland from widely geographical areas who are coming down with the same cancers. So she was interested in determining, was there a relationship between these 2 families, which would help to support, I guess, the notion or the belief that this was probably a genetic issue. So when she approached me, I don't know how she got my information, but I assume it probably came from actually an aunt of mine through Dr. Pollitt, because she was a patient of Dr. Pollitt's and she had cancer a number of times. And so I would assume that it came through her. So I did work at that time with a medical student who was working with Dr. Green, Dr. Sandra Loscombe, a pediatrician, and I worked with her that summer, and I was able to find the link, the family link. A woman from my ancestral family, one of the founding families in the area where my father came from, married into a family in another part of Newfoundland, and subsequently passed on the gene to one of her daughters, and that daughter married into a family, and then she passed on that gene to to her offspring. So the Lynch syndrome is the Lynch syndrome 2 is the problem, and it's caused by mutations and mismatch repair genes. And the genes involved in my particular family would be the MSH2 gene. And persons who develop Lynch syndrome are at risk for the following cancers. And each of these cancers are going to list, they've been in different people in my family.
Yeah.
Some over the years had multiple cancers in different areas. Colorectal cancer, of course, is most common. Endometrial cancer, obviously women, not men. Stomach cancer, small intestine, ovarian, urinary tract, pancreatic, skin, liver, gallbladder, bile duct, prostate, breast, and glioblastoma, brain cancer. Some healthcare professionals do not include prostate or breast cancer in the list, but as I said, members of my family have actually come down with both, and I currently have prostate cancer. So basically, those are the cancers that have affected family members for me. My paternal grandmother died at age 69 with endometrial cancer. My father had colon cancer when he was, as I said, 29 or 30, and that was back in 1949, and he went 14 years before he had another cancer, which was the squamous cell, and then, as I said, he ended up with a primary site in his stomach and a primary site in his pancreas with metastasis to the liver, and he died at 43. He had a sister who also inherited gene, and she had numerous cancers over the years, but she survived into her mid-80s. And at that time, she made the decision to stop treatment. She did not want, she felt it was becoming a burden on her daughters, and she didn't want to undergo treatment any longer. And she did live for a number of months, but subsequently died from urinary tract cancer. My father also had a brother who had a glioblastoma. I don't know if he inherited the gene or not. I was never told. His family were a little bit more secretive about it, but he had subsequently had 2 daughters who have died from cancer, and both of these cancers are within the Lynch family of cancers. So I suspect that they probably had the gene as well. I could be wrong, of course.
Yeah.
So that's pretty well it, yeah.
So Derrick, thank you for sharing this again. So it looks like you are very familiar with what it means to have a hereditary cancer, which means that, it's because of a certain DNA characteristics that are inherited from our parents to us, which increases our risk for certain cancers. And in your case, it's a hereditary colon cancer, I believe, right? And so you have lived experience of hereditary cancer, you have lived experience of genetic testing, and you have been involved in the research for so long as a patient partner. So how do you find all this recent progress in, genetic research and genetic testing? How some families are offered certain approaches, they are cared in the clinic, and so on. How do you feel about all of this as a person with a lived experience and experience in cancer research as a patient partner?
Well, I think it's very useful. Certainly it has been for me. I could probably say it saved my life, because I would say Dr. Jane Green and Dr. William Pollitt saved my life, because I had screening pretty well very quickly after it was determined I had the gene. It took actually a couple of years to find out that I did in fact have the gene, because the genetic testing had to be done in Great Britain at that time. And so once it was determined, I started having the screening, and early on in the mid to late 1990s, I did have precancerous cells discovered, which were dealt with at that time. And obviously these cancers, probably they were precancerous, looking at 30 odd years ago, probably I would not have made it this far anyway. They probably would have gone on to become tumors that would have spread throughout the body. So, I looked at the research. Obviously, it's extremely important because for me as an individual, it made me aware once I was screened that I needed to have tested. I needed to have screening for certain cancers that I was at risk of developing. And when things were found, they were dealt with early on. So as a result, I'm still alive today, and I'm over.
Yes. Well, there's a great manifestation of how your genetic information you knew about actually help you to get preventive care in the clinic through screenings and being informed. That's great. Let's talk about screening. This is such an important topic. So, folks, I'll just take a minute here to talk about screening. Cancer screening, we talk about in the morning as well. We wish it to be available for all types of cancers, but we are not there yet, but hopefully one day we will. So what screening aims to do is, kind of try to identify some clues that may be consistent with a tumor or cancer in the body. For example, for cervical cancer, mammography for breast cancer and colon cancer, FIT test is there, colonoscopy is there, lung cancer screening is coming. So, and there are others like skin and maybe prostate cancer screenings as well. But screening is really important in hereditary cancers, like in the case of Derrick and other families. Their genetic information kind of helped inform their physician to actually surveil or monitor their well-being or the tissues at risk of developing cancer. So looks like Derrick is benefiting actually from this information, and their physicians are really educated as well. I mean, we have to say that sometimes they are not aware of certain things, but in this case, it looks like Derrick's physicians are really taking great care of it. So this is for hereditary, but also as Caitlin said, up to 75 or 80% or more maybe of the cases are not hereditary, where the risk is maybe a combination of a number of different things, maybe exposures, age, our socioeconomic situations, diet, and so on. So in those cases, right, as Kathleen also said, genetic testing may not be an option. So, but you still have an option to learn about your risk and maybe screen. So this is specifically for those folks who doesn't have a family history of cancer or who are not considered a hereditary cancer family. When you reach a certain age, you are offered population level screening, even though you don't show any symptoms. For example, for colon cancer, for breast cancer, for cervical cancer, for other. Even though you don't show any symptoms, you are offered a screening test. You may want to talk to your physicians, primary healthcare providers, and get access to these tests. In some cases, they are self-referral. Like in Newfoundland and Labrador right now, the breast cancer screening is lowered to age 40 and women can self-refer. I think, if I'm not wrong, for colon cancer, we have a population level screening with FIT test. So you can self-refer, ask for the kit to be sent to your home. So whether or not you have a family or hereditary cancer case in your family, you have options to early detect cancer through screening programs. So, Derrick, you are certainly benefiting from screening as well. Is there anything that you wanna add about the screening programs? Any way to encourage everyone to maybe think about it?
Well, as I said, screening is extremely important, but I know when I would go for my colonoscopy and OGD, before I would leave the clinic that day, I was handed my next appointment to come back in a year. And the year I did discover the precancerous cells, I was back 3 times. And eventually they changed it to the recommendations were to be to have that particular screening, the colonoscopy and OGD every 2 years. So the last time I had screening for the colonoscopy and the OGD, it's roughly around 2 years ago now. So back in September of the last year, I thought, gee, I can't remember when I have my next screening appointment. So I called endoscopy and I asked them, I said, when is my next appointment? And I gave her my information, and the person I spoke to said, "Oh, you're not booked." And I said, "Oh." I said, because before automatically I would be booked for the next one. And I said, well, what do I do now? And she said, well, call this number. I called a particular number, and I got 4 possible other phone numbers to call, which I did. And it was met with either a tape message or further instructions to call somebody else. So eventually, I found it very frustrating, and I was finally did reach someone and spoke to someone back before Christmas last year, and she said that, oh, you're going to have to get another referral from your GP. And I said, gee, I got to get another referral. This situation is known, and well, I'll go ahead and I'll do it. So then I thought, well, there's an awful lot of people out there in this province who don't even have a GP. What would they do if they suspected a problem? And but I did speak to my GP by phone after 3 weeks waiting for an appointment. And it was only this past week, actually, that I did receive a letter from an endoscopy telling me that I was now on a waiting list. And I called yesterday, actually, to find, okay, how long is this waiting list? And I was told, well, you're actually due, in early this summer for your next one, but you won't get an appointment then. And I said, well, when will I get, by what time? She said, oh, it could be a fairly long wait because we're quite being behind. And you have to have, 2 different screens done in one day, and there's not so many, I guess, days set aside for that, for both the colonoscopy and the OGD. So, I was very disappointed by the fact that my information, obviously somewhere along the way, something's happened, and I didn't get the appropriate appointments. And the last time I saw my urologist, I wasn't given an appointment for my next cysto. And of course, bladder cancer is one of the cancers in my family as well. So to me, that's a bit of a problem. And so my issue is, I think that we need navigators.
Yeah.
I really strongly feel that we need to have navigators for people with genetic cancers.
Yes.
And I guess in every province, but certainly in my own province. And I would like to see someone with that knowledge and skill who would work with patients who have genetic risk to make sure that they are tested to see if they in fact carry the gene, and if they do, that they get early and appropriate screening, and that this person would actually arrange all that to make sure that this is done for the person, and that these wait times, and this obviously somehow or other it's failed me this past year or so. that this sort of thing wouldn't happen again to people, because it's very frustrating when you know that you should have this screening and you want to have it, catch things early, and you might have to wait probably a year before you actually get the screening. So.
Yeah. No, you made excellent points again, Derrick. So I think we certainly need patient navigators, patient navigator programs, hereditary cancer patient navigator programs, and we are going to talk about them in the coming sessions. Why they are so important, because it can be such a complex system to navigate if you have, a certain level of care. So thank you for that. I know you are one of the biggest advocates for the hereditary cancer navigators in the province. So hopefully one day we are going to see that. We have around 3 minutes now. Do you have any good news for us? Any messages, Hope, as a final word before we check the chat box?
Any final words? Well, if you suspect that there might be a genetic issue in your family, if you see all these cancers showing up, I can actually go back to the 1850s, and there are people in my family who had cancer back right to that time. So that's quite a history of cancer in the family. And once, if you do have, the screening, I should say the testing to see if you have a gene that puts you at risk of certain cancers, that you get screened, and keep that. Be an advocate for yourself and for your family. And, sometimes I have to quietly, I meet someone who has the maiden name of my grandmother, and I ask them, "Oh, do you have a lot of cancer in your family?" And I bring it up to them as subtly as I can, to make them aware that they probably might need to be tested.
Yeah. Well, thank you, Derrick. It's always a pleasure to speak with me. So I'm quickly looking at the chat box. Sorry, folks, I'm using 2 different monitors here. So a lot of people are thanking you for sharing your insight, that story, that's for sure. And yeah, there are other people who need to navigate through the screening program, certainly. Hopefully you have a patient navigator to talk to, or primary healthcare provider. If I were you, this is what I would do, because I have no other further information myself. I am this is not one of my expertise, but this is what I can say. So, and then, yeah, right, the appointments. Right, so I understand that. What else do we have here? My colleague Holly Echegari said that yes, there's quite a high level of support for navigators in hereditary cancers. This is great. Hopefully we are going to see that happening. Holly. Okay, has genetic testing identified hereditary genetic cancer marker or other marker? I'm not sure about this kidney disease, so sorry, I don't know whether there's anyone who can answer that question, but feel free to, folks, engage with the questions in the chat box to the level that you are comfortable of. So I think, Derrick, again, I want to thank you once again. This is, we have been working together for some time. You are always a pleasure to speak with, and I really appreciate your honesty and story and courage. Thank you.
Thank you. You're very welcome.
All right, folks. Thank you. So we are going